Are people coming in?
I'm pulling up the slides and then I'll let everyone in.
Well done.
All right, people are coming in.
Welcome, people who are coming in. Give us just a minute to get all our 164 registrants into this Zoom conference, and we will get started. So thank you all for joining us. And things will be quiet, so nothing's broken. Things will be quiet for a moment, and then we'll get rolling. How are we looking, Haley? We getting pretty much everybody in?
Yes, there are 80 people and counting.
Very good, very good. Well, we'll go ahead and get started then. Welcome, everyone. My name is Peg O'Connell, and I am the chair of the Care for Carolina Coalition. We are a coalition of, as of this week, 66 organizations from all across the state of North Carolina. Each member of the coalition and the coalition as a whole is dedicated to finding a solution for closing North Carolina's coverage gap. We are delighted to have you as part of this virtual forum talking about COVID and the health insurance coverage gap in what we have arbitrarily named the mid-state region. We have folks from Alamance, Guilford, Rockingham, and Randolph with us today. So welcome to you all. It is my very great pleasure to thank the co-sponsors for this event, so many of whom are your neighbors, for those of you who are from the mid-state area. First and foremost, Susan Shoemaker with the Cone Health Foundation. You've been such a good partner. United Way of Greater Greensboro, and we'll hear from Michelle a little bit later. Action Greensboro, the Greensboro AHAC, always a good partner across the state, the Guilford Community Care Network, and last but certainly not least, Team Reidsville. So we are delighted to have our name on a program with you all, and we hope that today will be exciting and informative for everyone. I'd also like to note that we have a couple members of the media, Tahesha Moyes and Michael Radisitz from WFMY News 2 in Greensboro. Our friend Greg calls them a regional powerhouse. And we also have John Joyce, who's with the Triad Business Journal. So we are delighted to have you join us. And if there's anybody else who's with the media and wants to put something in the chat box, I'll give you a special shout out so we'll know you're with us. I will say one word about logistics, and then we will move on with our program. So because we have so many folks on this call, we will keep all our guests on mute until it's time to open up for questions, which we will do at the end. So the process for that will be twofold. You can either put your questions in the chat box, or if you go to the bottom of your screen and you'll wiggle your cursor, you'll see a line that will come up and say participants. When we open it up for questions, you can click on participants, and that will draw all the names of everybody who's registered, and then you can raise your hand in that little box, and then we will unmute you, and you can actually ask your question in person. So I think, and now we are at 96 participants, which is very exciting. I think, Erica, this is the largest registration group we have had, and right now I think this is the largest number of attendees we've had. So welcome, everyone. And Susan, let me please turn it over to you for a few words of welcome, and then we will proceed.
Sure. Good afternoon, everyone. I'm Susan Shoemaker, president of Cone Health Foundation. Cone Health Foundation for the last 6+ years has worked commissioning research along with our partner, Kate B. Reynolds Charitable Trust, on closing the health insurance gap in North Carolina. So we spent a lot of time and advocacy around this very, very important issue. There are so many of our working neighbors who are in the gap, working multiple jobs. So we believe now is time. We are one of only 12 states left that hasn't closed the gap. We have excellent panelists, many that I have known, whom I have known for years and years, who you'll be hearing from, and we have panelists from every county in our mid-state region, which is newly coined, as Peg said. And we have Mayor Nancy Vaughn with us, who will provide some closing remarks at the end. So I will turn that back over to you, Peg. Thank you.
Very good. So let's see, we are at 98 participants now. This is like watching the lottery or something. So it is my very great pleasure to introduce a very good friend of Care for Carolina, Jason Gray from the Rural Center. Jason is absolutely fabulous with numbers, and he's going to take us through the economic and employment benefits and consequences of what's happened with COVID and what closing the coverage gap could do to help us make our way back from that. Jason, it's all yours.
Thank you, Peg. It's a great pleasure to be here, and I wish to give a particular expression of gratitude to Susan and the Cone Healthcare Foundation and the KP Reynolds Foundation for being such terrific partners. And I know Cone in particular in y'all's region is just a terrific partner to have. So I have about 10 minutes. Those who know me will say that I could easily take 20 or 30 minutes on this topic. So I am talking at a gale force wind level. Next slide, please. Okay, so what I'm going to cover here very quickly is looking at the context of the coverage gap from a chronic viewpoint and an acute viewpoint. That is, we have a pretty firm estimate of the chronic economic impact of the coverage gap in North Carolina. But we have a far less certainty of the COVID-19 pandemic short of long-term economic impact and what that means for Medicaid expansion. Three, there is mounting evidence, and we've heard it in some of our previous webinar briefings we've done across the state, that the pandemic has resulted in diminished revenue for outpatient hospital services and for general practices. This is critical for practitioners serving rural and or low wealth populations. Next. So I'm turning the spigot on for some data, most of which early on comes from this report, the Economic and Employment Benefits of Expanding Medicaid in North Carolina. This report was commissioned by the Cone Healthcare Foundation and the KP Reynolds Foundation, and was carried out by the Millikan Institute of the School of Public Health at George Washington University, by some very, very talented economists and policy experts. Next slide. So it's important to understand that the analysis that was carried out was done using an economic development methodology commonly used in the economic development field. It's a model called REMI, Regional Economic Models, Inc. And REMI and one other program called IMPLAN are the standard, they're sort of the Microsoft of economic development analysis of project impact. REMI examines the flow of revenues and outputs in local and regional economies, and we think multipliers. So an industry is recruited, they create 100 jobs. The income, the salaries from those 100 jobs filters through the local economy that then helps create other jobs and other income and so forth. So it looks at the multiplier effect throughout the whole economy, not just for the individual jobs. REMI is used by a variety of North Carolina state government offices, the Congressional Budget Office, the White House Office of Economic Advisors, and I will also say that it's used by the economic development partnerships here in North Carolina to, again, look at the economic impact of major projects. Next slide. So we got from the George Washington University team the county estimates for their work. The Rural Center, we categorize counties as 80 rural counties, 14 suburban regional city counties, and 6 highly urbanized counties. I'm a rural guy, so I'm going to focus in my brief times on the rural numbers here, because that's what's got the interest of the rural center in this issue is that what are the economic impacts of this? And we feel that they're quite substantial. So in the 80 rural counties from 2019, when this report was updated through 2022, we're looking at an estimated 11,000 jobs, $1.9 billion in economic impact, $1.9 billion. I think I said that right. And then local tax revenue of around $33.6 million. I will say, for those who are familiar with the Department of Commerce tier system, we know that there are 40 tier 1 counties that are deemed to have the most distressed economic conditions. The economic impact alone for those 40 rural counties, 40 tier 1 counties, which are all rural, is around $1 billion. So there's very few policy prescriptions the state could advance that would have as broad an economic impact as that has. Next slide. So for the counties in this area, and forgive me if I left off your county, we can look at Alamance County of having $159 million of economic impact. Guilford County, because it has a bigger population, more urbanized, more healthcare institutions, $683 million in economic impact over the 3 years. $95 million for Randolph County. And I want to give out a shout out to all the folks from Randolph County. My colleague at the Rural Center, Todd Brantley, grew up in Randolph County, and he's a huge advocate and admirer of all things Randolph County. Then finally, $44 million in Rockingham County. So the impact is real. Now, are these numbers set in stone? No. I mean, an astronomer can study a star 10 light years away and tell you it's the chemical composition of that star down to the second or third decimal point. Any kind of economic analysis like this is an estimate. There's always assumptions around it, but this is a tried and true economic modeling program. And even if it's 15, 20% overestimating the impact is still quite real. Next slide. Okay, so just looking very quickly here at the region, the region sort of splits both the center area here, 7,000 jobs. This is looking at it from the Economic Development Partnership regions. 7,000 jobs, 11,900 jobs in the triangle, 7,000 sort of spilling over into the triad. Next slide. In terms of just broad county economic impact, 1.6 billion in the triad region, 2.2 billion spilling over into the triangle. The triangle number is not surprising at all, given the concentration of medical services from both Duke and UNC hospitals and other hospitals. So, I mean, that economic impact is concentrated where there is the strongest medical professional focus. But again, that multiplies throughout the county, and even smaller numbers in a very rural county can have a lot of impact. Next slide. And then finally, looking at the regional impact of local tax revenue, $21.9 million for the triad area, 32 million in the triangle. And when you look down to the Sandhills to the south, $6.1 billion. This is a huge issue because of the pandemic. Local governments are taking a big fiscal hit, and I know our speakers to follow from representing cities can speak to that very, very well. Next slide. Okay, so I want to go from the chronic to talk about the acute, and we're going to talk about the impact of the pandemic. So for the 80 rural counties, looking at the change in employment from January through July of 2020, rural employment was down 5%, 94,000 people. Regional suburban counties, 105,000, and our 6 core urban counties, 155,000. Now, what's interesting to me about this is that this is a flip from the Great Recession from 2007 to 2009, which was disproportionately hit rural counties and rural places across the country. but the effect of the pandemic has really been more urban centric. Okay, so the numbers are improving. They're much improved over what they were in May, and I'm expecting the August and September numbers show some little bit improvement, but we're still way down. We've taken a big hit. Next slide. Okay, here's looking very quickly. This is the dashboard for unemployment insurance claims up through July 2020. It's interesting here when we look at continued claims here of the department is able to estimate which of those claims are COVID related. They're estimating 255,794. Next slide. Okay, so when you take total continued claims, COVID-19 related claims, COVID claims are about 70% of the total. So North Carolina has taken quite a hit. But things are getting better. Now this is where the picture gets complicated. Next slide. It's very hard to estimate for those who have lost jobs, whether they've also lost health insurance. Take, for example, if I lost my job, but my spouse, we had health insurance coverage through her employer rather than through my employer. Okay, so I show up in the unemployment rate, but I still have health insurance. So there's been a lot of guesstimation around the country around estimating what the impact is. It's all still relatively back of the envelope analyses. I just want to use one here just to project. So the Commonwealth Fund, which is a health-focused foundation, national foundation, they've done a survey that estimated that 21% of newly unemployed are without coverage. Using that estimate for the numbers above, that would be an additional 53,716 individuals. I think that's a reasonable number. I think it might be a little low, but I don't have better evidence. Within a year or so, we'll have very good evidence on that, but we don't right now. But we can say with great certainty that the number of people without health insurance in the state of North Carolina has increased notably in 2020. Next slide. We've heard from a number of sources, some of which we've had invitations, that the pandemic has had quite an impact on health providers. And I'll let my colleague presenters say more on this, but there is quite a bit of national survey work now on this. There's been a lot of national press focus on this. Pediatric practices in particular are hard hit, not in the Medicare stream. So that's been a real challenge. Last slide. I'm already well over my limit, and with that, I apologize. I would have to practice speed speaking to do faster, and you probably wouldn't want to listen to me if I did. But the closing points: Medicaid expansion, closing the coverage gap, has substantial benefits that advance competitiveness under the best of conditions. And again, this is why the Rural Center got involved in this. Feel for rural North Carolina to be competitive, we've got to address these issues. 2, in light of the pandemic disaster, closing the coverage gap would support a substantial number of North Carolinians who find themselves without coverage. Then finally, while not the sole solution, closing the coverage gap would generate increased revenue to economically devastated healthcare providers. I hope you found this enlightening, and I look forward to your questions later on, and I look forward to learning from the balance of our presenters. Thank you.
Jason, thank you very much. You always do such a good job of making the complex understandable for me, and that is always a challenge. So I know that everybody listening appreciates it. Our next speaker is going to talk about what's happening at the local government level. And Jason alluded to how it's impacting tax revenues, services, all sorts of things. So it's my pleasure to introduce to you the mayor of Reidsville, Jay Donaker. And Mayor Donaker, take it away.
Thank you, Peg. Good morning, everybody. I would like to introduce you to some basic information about Reidsville and Rockingham County so we can appreciate the impact of COVID-19 on our community and its access to health care. We are a community of about 15,000 in Rockingham County, which has a population of about 92,000. We have dodged being overwhelmed by COVID-19 infections as a city and county, but we do have community spreading occurring. It has only been during the last few weeks that a significant number of infections have occurred in some nursing homes in Rockingham County. We've had excellent collaboration between our local county and hospital agencies so that when the infections have been identified, they have been addressed quickly. Thanks also to these collaborative efforts, 30,000 free masks have been provided to our citizens in Rockingham County. 15,000 of these free masks have been provided for citizens in the Reidsville area. COVID-19 has caused our city administration and employees to become much more distant from our citizens. All our public buildings, our citizens are unable to enter unless they call ahead. Also, our employees must take precautions while interacting with the public. Our police officers are especially vulnerable in the way they interact with the public. Consequently, a few have become infected, but all have recovered. To address this weakening of our social interactions among our citizens, we have included in our Team Reidsville promotional efforts, emphasizing the 3 W's. The face masks we are distributing have Team Reidsville printed on them to help bolster our community spirit in which we are all in this together to address COVID-19. Having Annie Penn Hospital centrally located in Reidsville has had a huge impact in access to testing for our citizens. Which brings me to the issue of access to health care here in our local area. We are a county in which 50%, approximately 45,000, are insured by the companies they work for when last measured. However, since then our unemployment rate has gone from 4.5% in 2019 to 10% now. Another 34,000 are covered by Medicare or Medicaid. Approximately 15%, or 13,500 of our citizens are uninsured. But we also know that we have 18% of our population living in poverty or below in our county. It is logical to expect, based on these statistics, the 15% uninsured figure is lower than what is actually occurring now. And it does not count any of those that are underinsured. If someone is uninsured or underinsured, there is a burden on them and their family, as they are reluctant to seek medical care until a problem is much worse. What started out as a sore throat or a cough can progress to a severe shortness of breath. With COVID-19, this delay can and has been catastrophic. Prevention and early intervention of a medical problem has been proven to have much better health outcomes for our patients, along with less of a financial burden on everyone involved. There's also a burden on a hospital such as Annie Penn Memorial Hospital, as no one is turned away from being cared for. The financial impact with meeting COVID-19 challenges has been around $10 million to a hospital such as Annie Penn. This year, we are dealing with COVID-19. Next year, there will still be needs to be addressed both for COVID-19, but with all of other of life's emergencies. From the local perspective, what makes sense is to expand the insurance coverage for the 13,500 plus people not insured here in Rockingham County. Expanding Medicare Medicaid is just one solution to be considered to address some of this insurance gap. More competitive private insurance policies for our county would be another part of the solution for others. Part of the fear for many in becoming infected with COVID-19 is not just the health threat, but also the financial threat of having to pay the cost of treating and saving a loved one's life infected with COVID-19. Until these fears are better addressed by expanding health insurance and more adhering to the 3 W's of wearing a face mask, washing one's hands frequently, waiting 6 feet behind another, our community and our local economy will continue to struggle to recover from the impact of COVID-19.
Thank you, Mayor. Very well said, and we appreciate you taking the time to join us. Our next speaker is going to talk about what it's like to be a pediatrician in these days, what's happening to our patients, what's happening to their parents, and what's happening to the practice itself. So Dr. Boylston from Burlington Pediatrics and Mebane Pediatrics, we are delighted to have you. The floor is yours.
Great. Thank you so much, Peg. And I certainly am grateful to Care for Carolina and the Cone Health Foundation for sponsoring this essential dialogue and inviting me to participate. And I would like to frame my discussion today on the importance of the collaborative work of all of our audience participating today in rising to the challenge and meeting the moment. And I think COVID has really highlighted the importance of the intersectionality of public health, primary care, our healthcare systems, legislative actions, our economy. There's so many components to recovering and thriving after this. And I'd love to share some very local data from our practice that can highlight some of these, the importance of addressing the healthcare insurance gap. So if you'll go to the next slide, please. So Burlington Pediatrics and Mebane Pediatrics, we are an independent pediatric practice located in Alamance County, and we serve the communities of Guilford County, Alamance County, Caswell, and surrounding counties as well. And this just highlights some of the data that, that Jason alluded to. Our data is actually quite representative of what's going on in other pediatric clinics, actually not just in North Carolina, but certainly based on the American Academy of Pediatrics. Kind of trends nationally. And so this slide is just a very qualitative illustration that well child visits from the period between April to July compared to last year were down 17% for our practice. And why is this important? So well child visits are, I would consider them the haiku of public health. So it's really hard to appreciate what all goes into a well child visit, but we are talking about vision screen, health screen, social emotional evaluations. Are you growing? Nutrition, food insecurity. Is there any maternal depression? So there are a lot of things that are happening that's really packed in and hard to appreciate. But if you do have a chance, please, go with your niece or your grandchildren to their next well visit. And I think you'd be really surprised at some of the really front lines public health work being done, certainly in the pediatric well child visit, but also your annual health visit. A lot of collective health policy data that's evidence driven, you'll see reflected in your visit. And so this essentially means these children, the 17% that we're seeing the decrease, those children are not receiving timely vaccines. They're not receiving dental fluoride to prevent caries. And so the consequences are actually quite significant. Next slide, please. And this is just a capture of some of the urgent need to address supporting the medical home. And this is a great example of how there is such consequence for our communities. And so this is our data showing the decrease in vaccination rates compared to last year and this year during the COVID pandemic. And as you can see, I've highlighted the kindergarten vaccines. These include things like whooping cough, right? Tetanus, measles, which is highly contagious and it requires a really high herd immunity rate to be successful. And you can see in that period, we were down almost 20%. So you can imagine essentially 1 out of every 5 children in our community, when they, those who are either ready for kindergarten this year or next year, this is something that will need to be addressed. Next slide, please. And this is another slide that kind of shows the dimensions of vaccination and how critically important. Vaccinations were not just one and done in childhood. We have very important vaccines that happen all the way through. The seasonal flu vaccine. Gardasil is a cancer prevention vaccine for head and neck cancer, cervical cancers, anal cancers, and so we're seeing a reduction in that. The middle school vaccine, which is commonly, which we refer to as essentially Tdap, which is your tetanus and your whooping cough, we've noticed significant declines. And just keep in mind that in order to make up for this, coming back to 0 is not the goal. You actually have to exceed that to make up for all the kids who are behind on these vaccines. And this is all data that's very important for our Department of Health and Human Services, our local health departments, because guess what? The last thing that Alamance County Health Department needs is to deal with a COVID pandemic on top of a whooping cough outbreak, right? I mean, these are fairly disastrous scenarios. Next slide, please. So this is a slide that conveys, again, some of the frontline work that all of our community care providers are going through, and certainly the heroes are primary care, and certainly our health department colleagues as well. And this is a bit of a microcosm, because I know that collectively we're very used to hearing Governor Cooper and Dr. Mandy Cohen, who've done my personal opinion is they've done a phenomenal job navigating North Carolina through this really difficult time. But you might be familiar with the 5% positivity rate. That's essentially a guide for some of the phased reopenings. But just to highlight that depending on the community and the population, that there are hotspots. And COVID, if COVID has taught us anything, it's not that COVID has created any disparities. It's really revealed the racial disparities, the socioeconomic disparities, the difference between rural and urban, as some of our previous speakers have alluded to. And so, are we up to the challenge of really addressing these disparities to meet the needs of all of our communities? I think that's going to be essential. And here, just to show you, in August, the children that were tested directly through our practice, we had a positivity rate over 10%. And so this is concerning, clearly. And this is the type of local information that I think is really pivotal in addressing some of these things. So, on an aggregate level, it's really difficult to parse out where are the hotspots, where are the challenges. But as a pediatric provider, of course, I will champion children. And so I think some of the dialogue and some of the focus, really, I think children deserve some of that attention because this is a consequential infection for children. And I'd like for the audience to hopefully appreciate that. And so thank you for your engagement today, and I'm happy to answer any questions during the Q&A. Thank you.
Thank you, Dr. Boylston. And thank you for reminding us that kids are subject to COVID too. This is not just a disease that affects older people and the elderly people, of which I am one. So thank you.
Peg, I apologize. I actually do have one. Haley, can you go to the next slide, please? Thank you so much. So this is one of the most important things that healthcare providers and those of us can do is advocate for our patients. And so this is part of our voter registration initiative. And so please vote. I mean, this is what today is about, right? Engagement and making our voices heard. This is a representation of just a subset of many of our 60 plus employees and our partners, but vote. Thank you.
I'm glad we didn't miss that. That was, that is fabulous. I love that. And yes, it's up to us to choose the people who find that we can't wait any longer to protect our children and our families. So thank you very, very much. And I'm thinking we might borrow that from you. Thank you. Erica's going, yes, we will. All right. So that was fantastic. The next speaker, we are very pleased to have Angie Orth she's the CEO down at Randolph Health. And she is also a Cone alumni. And she said she started there when she was 17, and which was obviously just a few years ago. And then she zoomed immediately to the top of Randolph Health. But she's going to talk to us about what's going on in a rural hospital setting, and specifically what's happening with Randolph Health. Angie, thank you for sharing this story with us and for making time to be with us today. Please, the floor is yours.
Thank you, Peg, and I want to thank the Cone Foundation and the other speakers today for the opportunity to be able to share with you our story at Randolph Health. I also want to take just a minute and thank everyone that's on this call for your commitment to care for the citizens of North Carolina during this pandemic and during this time in healthcare, when it's probably the most challenging of at least my career and maybe yours. The providers and nursing staff and frontline workers amaze me every day. And so I just want to recognize them and thank them for the commitment they have made to our community. So if you would, Haley, advance the slide. So just a few key facts about Randolph Health. I'll quickly go through this and then talk with you about what we have gone through here at Randolph Health and in the county here. So we're a $118 million organization, 145 beds. We're a not-for-profit health system. We are the sole community provider, and we're the safety net provider for really citizens that are in the Ashboro community and surrounding communities, Liberty and Seagrove. We have 24 locations, 1,000 employees, and we're the 4th largest employer in the county. We serve 140,000 people. We are actually a very large county in North Carolina. The interesting part of our situation and our story that might be interesting to you is that we filed for Chapter 11 protection under the U.S. Bankruptcy Code on March the 6th. And that was a voluntary filing. It was something that we had planned to do as part of our plans to reorganize our organization so that we could perpetuate healthcare in the coming years. That voluntary filing happened on March the 6th, and the very next week, the COVID-19 pandemic was declared a pandemic. We fortunately, since the pandemic, have signed an asset purchase agreement with a buyer that is subject to overbids and a bankruptcy process and the bankruptcy approval. But on March the 6th, it was a very unsettling week, and what led up to that week was a lot of uncertainty, leading to a lot of confusion about how healthcare might be delivered in the future. So next slide, Haley. Okay, so just a few things about Randolph County and the citizens that we have here. So one of the comments that I'd like to make is that even pre-COVID, Randolph Health and Randolph County were struggling with the insurance gap. So we have many people in our community who do not have insurance. In fact, of the patients that we see, about 12% of them are without an insurance plan. 70% of our business is Medicare, Medicaid, Medicare MAP plans, and self-pay. So really over 70% of our business is in the governmental payer or individuals that have no pay. But in terms of our population, we have a very vulnerable population. We tend to be poorer and less healthy than the state as a whole. So if you look at North Carolina, we fell in Randolph County below the state average or median for income. We today have about 16% of our community is uninsured, compared to the state average at 15.1. We also have more people enrolled in the Medicaid program than other members in North Carolina. And we also serve a population that is older than a comparison of other communities. So as you can see, there's a strong need for healthcare in Randolph County. The health system itself is very important to the community, not only from an economic perspective, but to serve as a safety net for many people who have comorbidities and for those that really don't have the ability to go to another health system. Next slide, Haley. So this slide speaks to the rate of chronic disease that we see in our county. And so if you look at Randolph County compared to the state average, you will see that in most all of these categories, we have a higher incidence of a chronic disease state. So diabetes, cancer, heart disease, overdose deaths. I'd like to highlight that in the state of North Carolina, the overdose deaths per 100,000 people, the rate is 13 compared to Randolph County, which is almost 18. We have a high use of opioids in our community. We also have a significant number of mental health patients that use our emergency department as their primary source of treatment. And you can see that right there. And then teen births tend to be higher than the state average. Next slide, Haley. So just a couple of things about our community. In the county itself, we're the 19th most populous county in the state. We are the 11th largest in square miles, so it requires our EMS to go great distances to care for patients and to transport them from location to location. And then 50% of our population in our county is considered rural. So we have a lot of challenges here, and having a gap in insurance coverage really perpetuates that challenge. So as we were going through COVID, it became even more obvious that we need coverage for many people to be able to continue to access care. Haley, next slide. Okay, this is just simply a slide, and I've got the next few slides are simply slides about what is happening in Randolph County. This is from the North Carolina Department of Health and Human Services, and it just simply is an illustration of the types of patients that we treat by age. You can see that we predominantly have a Caucasian population. We, by age, patients and from 25 and up are experiencing COVID. So we have a mixed sort of age group of patients that have been diagnosed with a COVID with the COVID virus. Next slide. This slide really illustrates and this is from the county Public Health Department, but this slide really illustrates the new cases. And as you can see, the orange line is going down, which is good. We're beginning to see COVID sort of dissipate in our community. But during the time when we filed, which is really not on this slide per se, but you can see that after we filed bankruptcy, we were without a partner. We really did not have a future identified for our health system. Closure was certainly a possibility. We began to see the climb of new cases, and our organization went through a tremendous stress, preparing and immediately sort of moving to implement our plans around COVID to properly address people that were presenting to our emergency department, and also individuals in the community that were getting diagnosed by their primary care physician. But you can see that we're beginning to come out of this now, and I will say that I feel like that our organization has done a really good job of addressing this this virus and trying to mitigate it to the best of our ability while staying afloat and staying open. Next slide, Haley. This is simply our daily testing. So one of the things that we had to do really quickly was figure out how to test patients and how to bring on board rapid testing at a time when we had filed bankruptcy, that our cash collateral budget needed to be approved, of course, by the court. As we were beginning to think about how to sort of get into the bankruptcy process and work in that new world, we were also trying to figure out how to bring on testing. We were able to do that, and fortunately we have rapid testing here at Randolph Health. We can bring back results within 45 minutes. But this slide just simply represents the percent positive test that we are seeing on a daily basis now from August and September. So you're beginning to see that the virus is beginning to be under control here. Next slide, please. This is just our total testing, so cumulative testing, and this is Randolph Health data. So you can see that the green bar represents the total number of tests that we have done, which is over 2,500. And it simply just represents that we continue to test. We have a positive rate of about 7%. The state's goal is to get below 5%, and I think that we will be in that range very, very soon. Next slide, please. Okay, so what has really happened, and what have been the impact of COVID-19 on Randolph Health, and what are some of the things that we have had to do, and how does that sort of segment with or intersect with insurance gap, and the fact that many people in our community are out of jobs, they don't have coverage. So just a few things that have happened here. So fortunately, we were able to receive a significant amount of federal stimulus relief funds from the CARE Act, and that has allowed us to continue our runway so that we can stay open and stay afloat. All of that money, in our analysis, it looks as though that all of that money will be used, and it is much needed. When this first happened and COVID began to hit our county, we immediately, having filed bankruptcy and we had all of that in front of us, we immediately had to divert our attention and focus on our preparations, and we implemented incident command to address patients that were presenting. And so we divided our ED and we put it into two different sections. So we created a respiratory section and a non-respiratory section of our ED so that we could keep our patients safe and to mitigate the spread of the virus. That required that we repurposed our staffing and our ventilators. And so we actually moved our ventilators down to the emergency department. We moved our staff from our ICU down to the emergency department, and we closed our ICU. And that ICU was temporarily closed. And a decision that we made was that it was probably in the best interest for our patients to be admitted to another hospital. And so we developed a transfer agreement with a tertiary system and our partner, Cone Health, who has been a very good partner to us in accepting our patients. That took a lot of work and a lot of collaboration between our two systems. Fortunately, our patients have been safe and have been very well cared for. We've also had to hire a lot of contract nurses to support having two separate EDs. We also had to expand our relationship with vendors to adequately supply our staff and our doctors and our allied health professionals with personal protective equipment, because when you go into bankruptcy, your vendor relationships get interrupted. And so that interruption happened right at the pandemic. So it took a lot of resource of our supply chain teams and our leaders here to develop those new relationships to make sure that we had gowns and gloves and shields and things of that nature. Finally, I'd mentioned that we had implemented rapid testing, and then we were able to, fortunately, downstream open one site for community testing, which is at our Liberty Family Practice. But all of this work was happening at a time when our volumes stopped. We had to stop doing surgery. We had to close down elective business. So the money was not coming in. Fortunately, we did receive some federal stimulus money. People were losing jobs and continued to be unemployed. And we were actually challenged with this issue before COVID actually happened. So next slide, Haley. So I just want to thank you for the opportunity to make this presentation today. And I just want to just reiterate the commitment, the appreciation that I have for you as individuals who are interested in this topic and for the work that you're doing to keep our people safe across the state of North Carolina. Happy to take any questions at the end.
Angie, thank you very, very much. I'm sure there will be a number of questions for you. And thank you for carrying on through a very difficult time. I can't imagine with a pandemic at the door and out the back door is a bankruptcy court. So you definitely are heroes in Randolph County.
Thank you.
All right. The next person on our program is going to talk about the local economic perspective on how the coverage gap, COVID, and all the things that we've been talking about today are impacting her community. It is my pleasure to introduce Michelle Gathers-Clark. She is the president and CEO of United Way of Greater Greensboro. Michelle, please tell us what's going on in your neck of the woods.
Thank you very much for this opportunity. And I'd like for all of us to think about the narrative that now exists. There are words we're using right now that we never anticipated using. So the narrative for 2020 really sounds like this: COVID-19, unemployment, racial tension, business closures, remote learning, internet and technology disparities, working from home, stock market, loss and gains, low interest rates, bailouts, $600 unemployment supplement, $1,200 checks, masks, Karen, 200,000 COVID deaths, delayed health care, real estate market shifts, small business administration loan forgiveness, virus relief funds. All of these things impact the economy. Next slide, please. There is an unknown impact on who is insured and who is not insured. So are the new uninsured 255,000, Jason? Or is it 53,000? Jason shared a lot of really good information at the beginning. I will not go through it or repeat. Next slide, please. But what I will share with you is that the mid-state region has a condition that existed before COVID-19, and it will exist after COVID-19. So I want you to see on this slide, Alamance, Guilford, Randolph, and Rockingham counties self-sufficiency wages. So what is self-sufficiency, you ask? It is the ability for a person to meet their own basic needs without governmental support or private support. So you can see if you are a single person and you're in Guilford County and you make less than $10.74, said another way, you can't make it on your own. You need help. And if you're a single head of household with a preschooler who needs daycare and you live in Rockingham County and you make less than $16.36, said another way, you can't do it. If you are one adult with a preschooler and a school-age child and you live in Randolph and you make less than $23 an hour, something's gotta give. And if you are a two-adult household with two children and each adult is not making at least $13.72 in Alamance County, something's not gonna get paid. This has nothing to do with COVID. It is exacerbated by COVID. It is exacerbated by the new narrative that has been created. Imagine all of these families who relied on their children going to public school to get the education and to get lunch and to get breakfast. Imagine that financial strain. That's what we have to keep in mind. And so as we think about the coverage gap, next slide, please. The coverage gap impacts working class people. And so often the incorrect narrative is, those lazy people, why should we pay for their insurance anyway? The reality is, in our great state, this slide represents the top 10 jobs in our great state. And for this example, we're going to say that you are a single head of household with two children. If you are working in food prep, you got a problem. If you're working in retail sales, you have a problem. If you are a laborer, you have a problem. In customer service, if you're a customer service rep, and that problem is you can't meet your own basic needs, which means that you are more than likely uninsured. Many jobs, unfortunately, do not offer insurance to everyone. And so there's not universal coverage. And the only position on this chart that pays a self-sufficient wage, and I was not paid by Cone Health to put in front of you, is a registered nurse. When you are in a home trying to raise two children and you are not making $25 an hour, and if you work in one of the top 10 jobs that is not a nurse, you have a financial challenge. And so a couple of things that I would love for us to think about. I would love for us to think about creating a new narrative as we talk about expansion. We must be ambassadors for expansion. And very specifically, that new narrative needs to take into account recovery from COVID-19, but it also must tell the story that expansion is good. You see, Jason already told us that more revenue comes to North Carolina. We already heard from a pediatrician that our children need coverage. We heard that there are health disparities, and they're real. And they're real whether you are in rural North Carolina, whether you are low income, or no matter what your race is. Those disparities exist. And the chart that I am sharing with you suggests that workers deserve coverage. And yet, the minimum wage in our great state is $7.25. There is work that we can all do, and it's been made clear, yes, we should vote, but we should also think about how can we work together to ensure that children and families get the coverage that they need, because they need help overcoming the barriers and the obstacles of not only poverty, but also of being low income. We do have an opportunity that is before us, and the facts are clear and compelling. Expansion is a good thing for everyone in our state, including each one of us on this phone who are blessed enough, the majority of us, to have health care. We've got to work together, and this has got to be part of our ongoing narrative. So I thank you for your time and attention.
Oh, Michelle,
Yes.
that was amazing. Thank you. I'm not usually left for words, but you said them all so beautifully. And I had the ability to scroll watching people listen to you talk. And when I asked you to bring us on home, you nailed it. You really did. Thank you. Thank you very, very much. So, all right, I must collect myself. Now, Michelle talked about we have opportunities. We do, and I'm going to ask the Director of Care for Carolina, Erica Palmer-Smith, who many of you know, have seen, have talked to talk about what's in front of us, what can we do, and also some numbers from a recent poll. Erica?
Most importantly, let's never put me behind Michelle on an agenda ever again. That is quite something to follow. Michelle, thank you so much. And thank you to all of our speakers. I think you all have seen a really strong description of the difficulties that the region is seeing due to COVID and due to the coverage gap. And so I do want to talk about an opportunity. And Haley, next slide, please. We do have an opportunity right now in North Carolina to expand quality, affordable coverage to nearly 750,000 North Carolinians. We have an opportunity to ensure that all of our frontline workers have access to timely testing and treatment for COVID-19. We have an opportunity to help stabilize the healthcare system by reducing the amount of uncompensated care. We have an opportunity to provide a lifeline to struggling families, and we can do it with 90% federal funding. There have been multiple pieces of proposed legislation that have been proposed in North Carolina legislature over the last year and a half. We saw the bipartisan House Bill 655, North Carolina Healthcare for Working Families, pass out of the House Health Committee 25-6. Only to sit on the House floor while leadership refused to give it a vote. We've seen House Bill 1040, Healthcare for Working North Carolinians proposed, which would expand Medicaid in North Carolina. That bill has not been given a hearing. We've seen House Bill 1103, Access to Affordable Healthcare for All, proposed by Representative Cecil Brockman in the mid-state area, which would have provided subsidies for those folks living in the coverage gap. That bill has not received a hearing. North Carolina has the opportunity right now to close the health insurance coverage gap. And right now, as you can see from these presentations, right now is the time that we need to act. Next slide, please, Haley. And we know that North Carolina voters agree. Care for Carolina, through a Voices for Healthy Kids grant, was able to conduct a poll through the D. Stewart Group and Harper Polling in August on the 26th and 27th, a poll sample of North Carolina voters on their opinions on the coverage gap and related issues. And next slide, please, Haley. Not surprising to us, based on the community conversations that we have had over the last few years, 75% of North Carolina voters support closing the health insurance coverage gap. Only 16% oppose. 75% of North Carolina voters. Next slide, please, Haley. That held up across every demographic. It held up regardless of political ideologies. We saw 64% of Republicans support closing the gap, 83% of Democrats, and 76% of unaffiliated voters. We saw that hold up whether someone identified as a liberal or all the way to very conservative. It held up whether someone was over 55 or under 55. It held up across racial differences, across gender differences, and across every regional media market in our state. A couple of things that we know really contributed to this. We've talked about unemployment and uninsured or lack of insurance during COVID-19 and those increases. And what we found in our poll was that a third of North Carolina voters are concerned about their own family's access to health care right now. A third of North Carolinians are concerned about their own access to health care. And 78% of them recognize that the impacts of COVID-19 are going to be long lasting. When we ask specifically about Medicaid expansion, we found that 77% of North Carolina voters supported Medicaid expansion, and that again held up regardless of political affiliation or any other demographic. Next slide, please. We were fortunate to be able to do some individual polling of some key Senate districts across our state, and one of those Senate districts was Senate District 14. Senator Gunn currently holds that seat, and he is retiring. Next slide, please, Haley. We found that in all of those Senate districts that we polled, when we went into some specific areas, that in all of those areas, these numbers held up, that we saw a vast majority of voters supporting closing the coverage gap. In Senate District 24 that we're covering with this Mid-State Forum, 64% of voters in this particular Senate district support closing the coverage gap. Thank you, Haley.
All right, so thank you, Erica. And so I know I saw some people making notes. You will get all these slides. We have recorded this so that a recording of this is available if you want to go back and listen to some of these wonderful presentations again, or you want to feel like you went to church, you can listen to Michelle again. So now we have time for some what we have called facilitated discussion. So a couple of ways to do this. We can do, you can put a question in the chat box, or you can go to the participants logo at the bottom of your screen, and then your name will come up and you can raise, there's a click thing, you can raise your hand. So, and then Haley will unmute you. As we get ready to do this, I want to do one thing that I should have done at the beginning, and that is specifically when we wanted to come to the Mid-State region, we asked Susan Shoemaker and Sandra Bowen to introduce us to some of their best friends. And they, as Susan, you and Sandra did an amazing job. And we hope that your best friends will now become our new best friends, because each speaker was just amazing. And then I want to take the privilege of the chair and give a shout out to two folks that I haven't seen in a while. John Curran, former head of Alamance Regional. Hey, John. And Kim McNeil, you're on here someplace. I saw your name. She's from Rockingham County and a good longtime public health friend. So we are getting a question. And Erica, I'm gonna, Tahisha, if you want to, I'll just ask your question for you. And if you want to ask a follow-up, you can either do it yourself or I'm happy to facilitate it. So Erica, we have from Tahisha at Channel 2, if everyone supports expansion, why do you think the legislature isn't passing the legislation? Anyone else could answer if you have input. So Erica, you want to start?
Sure, I will absolutely start us out with this. So unfortunately, I wish that I could tell you exactly why leadership has not chosen to take this up. But what I can tell you is that while we know we had the support in the House by and large to pass a bipartisan bill last year, and while we know North Carolina voters support this issue, that leadership in the General Assembly has chosen not to make this issue a priority, to take it up and give it a vote. Last year, we were promised a vote on House Bill 655 publicly by the Speaker, and unfortunately, they chose not to take that vote. So I believe that the issue at this moment is that our legislative leaders have chosen not to prioritize the issue.
Other panelists, any comments on the question from Tahisha?
Yes, I'd like to just add a little bit to that for a little bit different perspective. It appears, watching the legislature over the last couple of years, that there is an attempt and a continuing attempt to continue dogma that has been put forth primarily by proponents like Grover Norquist, that a state does not need to share its medical responsibilities with any type of federal involvement other than what's currently here. And unfortunately, we're a state that's still adhering to that dogma. And it's a shame, but it's a good example of where some politicians are more married to their dogma than to what truly is of benefit, as we found out today, to 75% of the vote of the population.
Thank you, Mayor Doniger. Any of the other panelists, any other thoughts on that question? All right, thank you. There was an interchange between one of the Senate leaders who's known well to Mayor Doniger and a reporter recently, and the reporter said, what is it that you know that people in 38 other states which have adopted some kind of a plan don't know? The reporter never got an answer, and all she got was a dirty look, I'm afraid. So I think that's becoming the question more frequently. What is it that other people know that we can't seem to figure out? All right, other questions in the chat box or raise your hand. I will actually, if it's all right, if there's not another question coming in yet, ask Dr. Boylston a question. Haley, if you can take Dr. Boylston off mute. So you talked about the health impacts of what happened when COVID came to town. You've also sort of laid out the demographics of your practice, which is largely children. But tell us, I know our friends at the Pediatrics Society did a survey about the financial impact to practices by COVID and by the lack of insurance for some people. Did your practice experience that kind of financial impact?
Yes, thank you so much for that question. And we certainly did. And I think that really reflects it's this overpowering, pressures of trying to provide quality care, continue to employ all of our staff. And so, it's very important. We are in healthcare, but we're also a small business. And I think that we really felt the impacts of pressures from both sides, trying to make the numbers work, but also continuing to provide the care and the standard of care that we know to be, to be of high quality. I think for us, I feel fortunate. I think we've made some good business decisions, but when your volume and currently, healthcare is still fee for service. So if you don't see patients, you don't make money. And I think that when you're seeing declines of close to 40-50%, which pretty much all medical practices in the months of April and May were experiencing, that's cutting your revenues by essentially half. You still have overhead. You still have to pay for vaccines. We have hundreds of thousands of dollars worth of vaccines in our fridge that we have to take care of. You're still paying employees and their benefits. And so I think for our colleagues across the state, the smaller practices, and the rural practices particularly are really struggling. They tend to be primarily independent, so they don't have the support of large systems behind them to provide that funding. And so I think the critical just existential crisis that they're experiencing really should be addressed. I do want to acknowledge the state legislature. They came through for us and they recognize this need. Recently, they passed a $25 million support bill for independent practices that are able to demonstrate this need. And so I really applaud them for listening and being receptive to this need. Because essentially, if the rural areas lose healthcare providers, that would have disastrous consequences for our areas. And it looks like Jason has an add-in, so I would love to hear his input. Thank you.
Very good, Jason.
Thank you, Dr. Boylston, for your highlighting the rural challenges. I think one of the real challenges we face is to understand that as important as it is to get healthcare coverage for the roughly 500 to 600,000 people in the state, and that's so important for all the reasons that Michelle so well pointed out, is that we have a bigger issue of how do we have a quality health ecosystem in the state. That is, of private practices like Dr. Boylston's, of financially secure hospitals. We've had 7 or 8 hospitals in North Carolina close that were all rural. We cannot have a competitive rural economy if we do not have a sound health delivery network. It will not work. It is as essential as housing, as quality education. So what we see in Carolina is what we see also across the country, that the health metrics now are in states that did not expand, that the worst economic outcomes, particularly in rural areas, are in states that did not expand. We cannot have a competitive rural economy if we don't have this done. Is it the sole solution? No, there's a whole bunch of things that we need, but it is a necessary but not sufficient answer to meeting the needs of rural North Carolina and to many of our urban brothers and sisters.
Very good. Thank you, Jason. So we did get a question which just vanished from Monica Brown, and we're getting some other things in the chat box, which I will turn to. So the question from Monica Brown is, Monica, I don't see you, but we've got so many people, so wave your hand so people know it's you. How would, Eric, I'll let you start with this, and then even though I'm the moderator, it's sometimes hard for me to keep my lips quiet. So how would Medicaid expansion work in light of the recent push for Medicaid transformation to Medicaid managed care? You want to take a shot at that?
Absolutely. And I think I'm glad you asked that question, because it actually makes it the prime time for us to expand coverage in North Carolina. As we're transitioning to this managed care system, it is the perfect opportunity for that to be the same time that we're adding folks in to get affordable coverage options. So DHHS has indicated that they see this working seamlessly, that this is something that they can do really, again, at this time, better than any other. So we think it's a really great complement. Peg?
No, that's exactly what I was going to say. So you passed the test. Yay. Thank you, Erica. We've heard this from DHHS a number of times. In for a pound, in for a penny. Now Meg Malloy, who has been our partner working with NC Child, if you want to just say a quick summary of your comment in the chat box, and then we will, some other things have come up.
Sure, I think I'm unmuted. Thanks, Peg. Yeah, I just wanted to say that for the last year, many of you all have been signing on to show your support for this issue. And the question is, why has our General Assembly not passed this? Some of that is our opportunity to share how much community support there is and to let our electeds know that. So many of you have signed on. Dr. Boylston's practiced it early on, the Alamance Chamber. Mayor Nancy Vaughn just signed on last week, Annie Penn, Cone Health, Kim Gatling, the Eden Chamber, and probably more of you all than I even know. But I've been collecting those names, just over the last year, and we have the opportunity for all of you to also share your support. So you can go to the Care for Carolina website and click on Act Now if you would like to add your own business name. If you sit on a board, it's a little bit more complicated, but let us know and we can help prepare information for you to take to your board, because having your leadership support for this is what is going to help us extend this to the General Assembly and help them understand how they can support our state.
Can I just say a quick thank you to Mr. Tom Cone for filling out the business leader endorsement right as Meg was speaking. Thank you so much, Tom.
And so I have to ask you, Tom, are you related to Moses Cone?
I'm unmuted. Yes. Great nephew.
Very good. Very good. Well, we're glad to have the family still in the business. Excellent. Wanda Martin, excellent presentation and information. We will do our darndest, Wanda. We will do our darndest. Meg, you gave a beautiful setup for me to ask Mayor Vaughn if she would make some closing remarks, or a few remarks. They don't have to be closing. If we have time for a few more questions after, we would be delighted to take them. Mayor Vaughn, if you would give us a few thoughts.
Thank you. It is my pleasure to be here this afternoon to take part in this very important discussion on closing the healthcare coverage gap. One of the reasons that I hear quite often on why the legislature is not anxious to take up healthcare is that at some point they're afraid the federal government is going to step back and pull back their funding. But of course, many states for 10 years has had the federal funding, and we have not had the benefit of any of the federal funding. Oklahoma just this year put it on a ballot, and it passed by a very slim margin, but it did pass. And their conversation in Oklahoma was very similar to the conversation that we have, where it's the urban-rural divide. But it did pass, and they will do the Medicaid expansion, and that is something that I think is hopeful that if we can have a state like Oklahoma do it, then it's possible that a state like North Carolina can do it. One thing that I think Jay will attest to is that as mayor, we get an awful lot of data. And just last week, we had 3,455 calls for service with our police department. And about 20% of those calls are usually mental health or addiction calls. And we get those calls because those are people without health care and they have no one else to call. So they call the police. And that is a shame, because those are people who have nowhere else to turn. And so we have now started a program where we will dispatch mental health workers with our police department. But when people have nowhere else to turn and the police is their last line of defense, We know that we have to do so much better. And what this expansion could do for people like them, this would make so much of a difference. We were talking about overdoses before. So far this year, the police have responded to 463 overdoses. 76 have died. We talk about homicides, but we have had more overdoses in the city of Greensboro. I mean, these are hard and fast numbers. So, we have had fatalities where if we've had this expansion, it can really save lives. So, we talk an awful lot about the business case or the moral case. And I think at a lot of times you can talk about big issues in those ways. So I think we can go to the legislature and say, you've got the moral case and the business case. The business case is that we can be a more attractive community. We can be more competitive. We'll have less poverty. We'll have more revenue. We'll have more jobs. We'll have less health disparities. The moral case is that we'll have better quality of lives. People will have more disposable income. We'll have better health outcomes. People will live longer lives. I mean, we can go to the legislature with really good arguments. When we talk about the legislature, it's not a huge body. There are only 50 senators and 120 representatives. So we're talking about a total of 170 people and the governor, right? We only need half of them. So we're talking about 26 senators and 61 representatives. We need 87 people to pass this, right? That's what we need. They're all up for election. So I know we only have a couple of weeks. We've got 40 some odd days, but it's really not too late to really put the pressure on and get people to go on record on whether or not they support this. We've got the data. You've just given it. Michelle's given it. Jason's given it. I mean, it's all here. Get people to go on record and say where they stand on this very moral issue. Write letters to the editor. I mean, just put it out there in black and white and say, where do you stand on this issue? I think it is very important that you see the polling data. It's kind of hard to say no. There's a lot of waffling on this healthcare issue, but it's pretty easy. And, we're only talking about 87 people to come down and say yes in a state of 10.5 million, right? We're a state of 10.5 million. We only need 87 people to say yes. We've got a little better than 40 days. We can do it.
Well said. Well said.
Bravo. Thank you, Mayor Vaughn.
Thank you.
Yes, I was going to say, you're getting a lot of waving hands and waving arms. Thank you very, very much. So as Mayor Vaughn said, it's time for us to do something. And the asking the candidates, I'm not going to tell you how to vote, but ask people who want to serve our state where they stand on this issue. It's important. It's a moral issue. It's a financial issue. And it's the right thing to do for our state. So if there are any last minute questions, or Erica, do you have any last minute remarks?
No, thank you so much, everyone. If you would like to get more involved, please reach out. If you want to get more involved as a business owner or would like to sign up any board that you sit on, please reach out to me or Meg. We'll send some follow-up information, including county level data for each of your counties, but please don't hesitate to reach out with any questions. We're happy to help help you help this cause in any way that you can. So thank you so much.
Thank you. Thank you. Jason, as always, it's wonderful to see you. Susan, you are a wonderful hostess. And Dr. Boylston, thanks for being here from the home folks in Alamance County. Angie, thank you for telling us your compelling story. Please keep us advised how things go, and we will keep all fingers crossed that Randolph comes out on the good side of all this. Michelle, all I can say is amen. Thank you very, very much. And Erica, you always do such a great job. To all our speakers, especially to Mayor Vaughn for that call to action. That was fantastic, and you ended us on just the right note. We will keep you informed. We're doing more of these forums around the state. We will be in the southeastern part, several counties down there next week. We will be out in the Iredale, we gave that a funny name too, Central Carolina, something or other. So we are, and then we're going up east for all of the finger counties and many of the counties up east. So if you'd like to join us again, we'd be delighted to have you. So with that, unless anyone has any last remarks, the chat box is exploding with good comments. Thank you all very much. I think our meeting is adjourned. Take care, everybody.
Bye-bye.